Hi, I'm Maia from the Lucan Center, and today we're going to talk a little bit about the difference between self-harm and suicidality. Self-harm, also known as self-injurious behavior, is the act of intentionally causing harm to oneself, often for the purpose of coping with unregulated or overwhelming emotions. Suicidality, however, refers to struggling with ideation related to wanting to end one's own life. It is important to understand that there is a difference between the two so that we can treat and respond to each appropriately. When an individual engages in self-harm, it releases a number of chemicals in the brain, one of those chemicals being dopamine, a neurotransmitter associated with pleasure and reward. Dopamine is released in the brain to compensate for any pain felt during the process of self-injury and also provides a temporary sense of relief or distraction for the individual engaging. Oftentimes, however, this release of dopamine can reinforce the behavior for the individual engaging and may increase the chance of reaching for something like self-injury in the future when trying to manage unregulated emotion. So it's important to distinguish the difference between self-injury and suicidality. While self-injury is often driven by a desire to help regulate unwanted or unmanageable emotions, it is not always associated with the idea of wanting to end one's own life. Suicidal ideation, however, is often driven by a desire to escape something and find a more permanent solution to the unmanageable emotions. It's crucial to take self-injury seriously and support those struggling through it. It is not a cry for attention, but rather a cry for help. Instead of dismissing the behaviors, it's important to encourage open dialogue regarding the unmanageable emotions that an individual may be experiencing, as well as helping support them find alternative coping mechanisms in the future. One type of therapy in specific that may be helpful for an individual struggling with self-injury is dialectical behavior therapy. This therapy modality was originally designed around those struggling with either suicidality or self-harm, and a lot of coping mechanisms are specifically designed around helping regulate and tolerate those really unwanted or unmanageable emotions. One specific coping mechanism that's often recommended through dialectical behavior therapy is the TIP skill, which stands for temperature change, intense exercise, and paced breathing. To learn more about our TIP skills, check out our video.